Good afternoon, everyone. I think let's just wait a few minutes for other people to join in, then we can get started. So good afternoon again. It's now 2:15. We can now start our session. My name is Tumai Muzorewa. I'm going to be your moderator for this session. Just a few housekeeping rules to start off with. We're going to have two live presentations from AFRE Health and APHRC. While the presenters are projecting their screens and presenting their slides, please may you kindly put your questions in the chat, and then we'll address those at the end. So first we have Esther and Georgina from AFRE Health. I understand, Georgina, you're going to be sharing your screen and Esther is going to be presenting. So over to you, ladies.
Right. Yeah, thank you. Esther, please can start.
Okay, good afternoon, good morning, good evening, wherever you are. I'm Esther from the African Forum for Research and Education in Health, but my home institution at Saba University, Department of Medical Laboratory Sciences, representing here AFRE Health. Next, please. We really thank you so much for giving us this opportunity of networking. Next, please, Georgina. So AFRE Health, it's a Pan-African network of health professionals and institutions, and it works to achieve excellence in health profession, education, health, research, and service to ultimately improve the health outcome of Africans. It advocates for interprofessional education, and it serves as a leader and convener of scaling up South-to-South networking in collaborations across the continent. And we know the challenge of the health workforce we have in the continent, and AFRE Health is striving towards achieving this through interprofessional education and research. Established in 2016, AFRE Health is legally established international NGO with good governance structure. We have the governing council from all AFRE Health partner institutions, EXCO, subcommittees for our different activities. We do also have regional chapters and fully functional secretariats. As you can see here on this map, AFRE Health organizations are found in almost all regions, except, as you can see here, in the gray area, where we feel we have to reach out and, in these gray areas. And our partners, our members are all health cadre, medical doctors, nurses, midwives, pharmacists, labs, dentists, name it, all health professions. And we do have researchers from basic up to implementation science researchers. And our partners are teaching institutions, research institutions, policymakers, government and non-government, local and international institutions. Next, please. Next, Georgina. So we have this motto of leading Africa to better health outcomes through research, capacity building, knowledge generation and sharing. Our research mainly focused, especially during the COVID era, COVID in pregnant women, in pediatrics, and we do have, in 12 member states, we had research on COVID vaccine effectiveness. I will, in a few minutes, I will go to the details, and COVID and sickle cell disease in 10 African countries. And we do have health professions, education, and research. So our research area spans mainly in these areas. Otherwise, it doesn't mean we are not having the NCDs, HIVs, and others. In terms of capacity building, we do have a James Hawkins leadership program, grant scientific writing, learning management system, HIV and COVID. We do have capacity building on pedagogy, on antimicrobial stewardship. This is a recent engagement that we will be undertaking very soon, and also interprofessional education and student exchange in African countries, pharmacovigilance in 14 African countries. This is a MasterCard Africa CDC project. And in terms of knowledge generation and sharing, we do have a series of webinars, annual symposiums, communities of practice, different technical working groups. We do also have student community. Next, please. So in terms of data generation and utilization, our experience, next, please. So our major experience is related to the COVID era, where we do have the COVID-19 and sickle cell disease study in African countries where sickle cell disease is a major problem. So here we do have a multi-country study, and the study examines in hospital mortality before and during COVID, and our goal is to generate context-specific evidence to improve the clinical care and inform sickle cell disease management policy. And we do have principal investigators from 12 African countries. This is, collaborations within Africa by Africans. And it has a model of enhancing study quality, position Africa to lead sickle cell disease research through evidence-based strategies. Next, please. So the key outcomes of this multi-country sickle cell disease and COVID study, we ensured strengthened research, regional research collaboration. As I said earlier, this is a multi-country study. Some of the African studies, as you know, we Africans, our collaborations are westly, mainly with the North or the West. We don't have so much collaboration with them. So it enhanced regional research collaboration, South-to-South capacity building, and it's a model for South-South collaboration, and also informing policy and practice based on our data. Next, please. Next, please. So our second flagship project of AFRE is what we call the PROOF project. This was a strengthening partnership for sustainable public health research in Africa. And this was a flagship initiative under the Africa CDC Mastercard Foundation, the Saving Lives and Livelihood Project. And this is a very good collaboration with the Infectious Disease Institute of Makerere University. Also in this forum, and the AFRE Health collaborating with the National Public Health Institutes. Usually, we know we academia, it's not common to see collaborations between academia and the implementers, the Ministry of Health, the National Public Health Institute. But this project has really demonstrated a very good collaboration between the research people who generated the data and the policymakers and the implementers from the Ministry of Health through the National Public Health Institute. We implemented it in 12 African countries from the 4 major regions, except the Northern Africa regions, which we always strive hard to reach out with 3 aims of one, vaccine effectiveness, health professionals, perceptions about the COVID vaccines, and most importantly, the impact of COVID-19 on the health programs of Africa, that is, name it, including maternal, child, API, about 14 programs using the DHIS2 data. Use of this DHIS2 data has helped us to identify challenge of our DHIS2 data, their quality, which was really very useful to advise, to inform our policymakers in the health ministry. Through this project, we have generated a big data, you can imagine, from 12 countries on all health programs. And so far, several publications have been emanated on the Journal of Public Health in Africa. And also, we are continuing developing manuscripts. It's such a huge data that we have in collaboration with IDI. And we do have also policy brief to our respective health ministries. Next, please. Next, please. So again, the key achievement, there was a capacity building component. We are talking about data science, we are talking about data sharing. Are we Africans really ready to make use of our rich data and make it open? So we have to really have empowered researchers in Africa to use our rich data. We know that data is fuel now. So we have to really strengthen the capacity of African researchers, including the young ones. So it has a capacity building component, it has a knowledge generation and policy influence, because as I said earlier, we were working with the National Public Health Institutes and Ministry of Health in the respective countries. So we really have those information on vaccine uptake, hesitancy, efficacy, as well as the effect on the health programs in Africa, in the selected African countries, regions. So we really ensured that there is a collaborative networks established, like a model of we were interdisciplinary. There was cross-country collaboration between academia and PHIs, as I said, and it created a sustainable foundation for ongoing research and health system resilience. Now we call ourselves like true family. Next, please. So there are also AFRE Health Small Grants Program for local solutions through interinstitutional funding. So we do have partners, institutions from Anglophone as well as Francophone Africa. And our achievements, so far 21 institutions have been engaged, multiple manuscripts have been produced, there was interprofessional collaboration formed, and regarding its sustainability and impact, there is strengthened research culture and grant management capacity across Africa. Next, please. So, networking, coming to this forum, what we can offer, as I said earlier, we can offer research partners across all member states, networking with diverse expertise, universities, research institutes in Africa, and would like to gain by partnering with researchers from this forum. We want to have collaborative research, networking, experience sharing, capacity building on data science. As I said, we really do have huge data on the health programs. And we also offer, we do have the AFRE Health Annual Symposium platforms. The last one, we have it in Nairobi, but the one which is ahead will be in Senegal, Sali, from September 22 to 24. All of you are invited to join us. And we do also have a functional learning management system with language translations, all our documents, training materials, we do have it in English, French, and Portuguese. And our platform is free for all members. So far, we do have 22 HIV and COVID-19 training modules in this language. We do have course for healthcare workers in LMICs on COVID-19. And we are also on the process, because we can reach out several young researchers, academicians through our platform for free. We want to also are working on the development of data science, which our collaboration with this forum could also help us to ensure, dissemination and, empowering Africans in ability to utilize big data. Next, please. I think in conclusion, our key message, partnerships are the engine of AFRE Health success and sustainability. That's what we always claim our firm stand. And as a next step, we will continue scaling up our learning management system content, strengthening technical working groups, expanding regional and global partnerships. And as AFRE Health, our call to action is please join us in co-creating sustainable solutions for Africa's health challenge. Next, please. So with this, I really thank you so much for the opportunity. We can answer during the question if you have any questions during the Q&A. Otherwise, we really appreciate the organizers and thank you so much for inviting us. Thank you.
Thank you very much, Esther, for a very informative presentation. As mentioned before, please put your questions in the chat. Next up, we have Agnes from APHRC. Please share your screen and start your presentation. May I ask Esther, please, to put your contact details in the chat in case anybody wants to contact you.
Well, I'll do.
Can you see my screen?
Yes, we can.
All right. Thank you so much again for the opportunity to talk about the African Population and Health Research Center and to see how we can leverage the organization and position it for a key collaborator in this very important virtual networking event. My name is Agnes Chiraga from APHRC. I lead the data science program, and I am giving this talk on behalf of the executive director, Dr. Catherine Chobutunji, who was not able to be present today. So I hope I'll do a good job. Okay, just a second. All right, so APHRC is an African think tank that was started in 1995 as a fellowship program for the Rockefeller Foundation, and it since then became autonomous in 2001. It is headquartered in Kenya through an agreement with the government of Kenya, but registered as a 501c status in the US. And it's now an African regional center headquartered in Nairobi. And then in 2019, we had a West African regional office that was opened up just before COVID to take care of the portfolio in the West African region. So who is APHRC? We are, like I said, an African think tank, and the vision is to transform lives in Africa through research. And the mission is to generate evidence through strengthening research and related capacity in the African research and development ecosystem. And this is really done through engaging researchers to have policies inform the action. And all of this really culminates into informing health and development in Africa. And how does this research really transform lives? And the best, or some of the ways that we're doing it at APHRC, is to have the evidence being used in directly or indirectly various decision-making at national or international levels. And then the other way is to have the research conducted to be done by more and more people. And in this way, more and more evidence is generated, accrued, and also used to inform the subsequent actions. So this is done through a broad range of partners that are within and out of state, out of Kenya, and also our partners, as we'll see shortly. And also we interact at multiple levels, at continental level, regional, national, subnational, and institutional and local levels. So we ensure that the decisions that we take that come out of this research do impact lives in various ways. In terms of the policies, they might come up with new policies, modify existing policies, or improve the way certain research or activities are conducted, and operationalizing some of these based on the research. We also ensure that the way the programs are done and implemented, that they're really evidence-informed. In terms of budget allocation, we are also making an impact on that and ensuring that the budgets are allocated effectively, responsibly, and reflect the bulk of the work. In terms of service delivery, we are also making sure that decisions do impact the way the services are delivered, guidelines are developed, uptake of tools and innovations, and also reaching out to the different individuals and the communities where the APHRC is placed and the partners that we work closely with. So those is really how the decisions from the work impact the lives of the different communities. And then now, what does this really mean? So the APHRC's work really revolves, like I said, around the evidence-informed decision-making. And it starts really formally by having this framework applied to different aspects of the work, right from the researchers, the operations, the implementation of work, and it's done in varying degrees to selected areas in health and development. We work very closely with governments and governments in Africa and ensure that most of the work and the evidence is sustained through strategic policy engagements and having different issues that are tackled as the institution using a signature approach, signature issues approach that we really help in creating a strong foundation in the way we do some of our work. We've identified different signature issues that the center is always flagging and ensuring that they're embedded in the different scopes of work. So the evidence that is generated is outward looking. It's aimed to have impact in a long-term manner. And as you can see on the right, that framework ensures that we prioritize the research through evidence. The evidence is then generated with different aspects, research, systematic reviews, or innovations. Then you contextualize this evidence in the areas where the research is conducted, and of course, see how this evidence is used. So that is really how we are doing positioning most of the work at the center. Then the center also has specific strategic thrusts, and one of them is systems thinking. This is something that from the onset of research at the center and different activities, we are infusing systems thinking in implementation research. And this is how research is generated, how it's taken to be evidence, and also how it's actioned. It's not just the lack of evidence, but how is this evidence really incorporated in different systems, the economic, the political, the financial, the social culture, and the knowledge, and how all these interact to really inform decision-making. Because if you tackle one front of a bigger problem, then you kind of run into the same thing in another front. So we always endeavor to have a systems thinking approach at APHRC. And then the systems thinking approach then is scaled down further into where do we actually then position this work? What are the existing systems for which we can actually place the work that is being done? There's a lot of efforts that are initiatives that are aimed to strengthen the research and development ecosystem in Africa. And this is through academic partnerships, which we'll see shortly, different collaborators with research, civil society organizations, and policy actors. And in that way, you're actually looking at the whole ecosystem. The other option is to look at cross-cutting platforms, and these are data platforms, researcher visibility platforms like the Africa Research Connect, capacity strengthening programs like the CATA, and also systems that are being developed to share data. And again, trying to endeavor that the systems thinking is done at different levels. And this is done through linking academia with different institutions and policymakers, the system thinking approach towards fund management, and ensuring that the partners who are involved right from the project inception are at the same table and understanding the whole scope of how this is happening. And of course, a lot of institutional capacity strengthening for our partners in terms of fund management, good grants, financial practices, and also ensuring that the culture is embedded in other partners that we work with. So in terms of the programs, the research programs, which I'll focus on for this talk, we have 4 broad research programs. We often refer to them as themes. One is the health and well-being, that is looking at all aspects of health as a center that is keen to inform evidence around health, population health. We do work around nutrition and food systems, and those are subunits within this theme: sexual reproductive health, chronic disease management, health system strengthening, and emerging and re-emerging infections. We also have a team that's dedicated at human development, and this is looking at early childhood development, youth transition, gender, education and higher education, education and technology, and also the higher education research. We have the population dynamics and urbanization that is focused on migration, urbanization, fertility, and demographic surveillance in different collaborating sites. And then last of the 4 is data science program, which is 3 years old and really looking at the way we can infuse data science, how we can create sustainable platforms, analytics, the use of new tools like generative AI, and also different modeling approaches. In terms of footprint, APHRC is, as of 2024, which was last year, we had done a couple of projects in 34 African countries. This keeps moving. This keeps changing depending on the current and closed projects that happen in partnership with a center in both Nairobi and the West African continent. And as you can see, most of the work for now remains heavily centered in Kenya. That is the dark green country there with 144 projects, but we are increasingly seeing this spread to other East African regions and also moving to the rest of the continent. So it is really in the different programmatic areas we've mentioned, and doing a lot of work around policy engagement and advocacy, capacity strengthening. We value these partnerships, and we ensure that in whatever partner and collaborations we are working with, that it is really respectable and sustainable and speaks to the context where the research is being done. And most of these partnerships vary. Some are short-term, some are long-term, but in all of these, we ensure that if the partnerships take on different models, some are really formalized partnerships with memorandum of understanding, some are more long-term, some are by default, depending where the funding is coming from. But in all of these, we've learned that there's need for mutual learning and capacity strengthening along the journey in onboarding all these partners. So we ensure that we work towards ecosystem strengthening, data systems, researcher visibility, individual and institutional capacity strengthening. We have the CATA program, which some of you might know. It's a capacity building program that works with about 15 universities, and it's really strengthening that ecosystem. We also have different capacity strengthening opportunities like the mental health data prize, which I'll talk about shortly, the Countdown 2030, which is a very large program looking at maternal and child health that recently released a Lancet issue on the state of maternal and child health in Africa. Then we'll talk about the Data Science Without Borders project in the 3rd round of, I think it's the next networking session. And yeah, and these are really what we aim to do. These are just selected projects. This is the Mental Health Data Prize that recently had awarded 10 grantees to receive funding around managing data around mental health in Africa. It's going to do a lot of work around building capacity in mental health through 21 courses, 3 webinars, and matchmaking events. And we're also doing a lot of work around the landscape of mental health and research in Africa. So it's one of those projects that is funded by Wellcome that aims to produce tangible and scalable outputs that are going to support mental health research in Africa. And then this is the Africa Research Connect. It's also another tool that I encourage all African researchers. In fact, we'll be happy to share this with our partners in AFRE Health to help discover, connect, and collaborate to allow African researchers to really collaborate. It's an online tool. You punch in your name. It's AI chat based. It's AI based. It scrapes the internet and allows you to find different researchers in your scope of work. So that is really what we're up to. We encourage partnerships, and we really think that the DSI community is going to be critical for us to expand the work we've done, reach out to potential collaborators, and allow opportunities for capacity building in data science, in data systems, and the other areas of research. And we are really available. Please reach out to me or anybody else from APHRC in case you have any other questions. We'll be talking about one of our landmark projects, the Data Science Without Borders project, in the next 30 minutes. So thank you, and I welcome any questions.
Thank you very much, Agnes, for that presentation. I see we don't have any questions in the chat. I don't know if anybody would like to. Oh, no, actually we do. We have one question here. I think this is addressed to Agnes. It says, can you please say more about the Qatar program and the acronym, and what does the acronym stand for?
Capacity building, let me put the link in the chat as we go. It's a capacity building program that aims to create different master's and doctoral level PhD training opportunities. It's in partnership with 10 universities across Africa. It is in a partnership with BITS and APHRC, funded by the Deltas program. And to date, they've trained about close to 300 PhD and master's level fellows across Africa. They have different sessions, capacity building, scientific workshops, seminars, and I'm just posting the chat right here. Thank you, Miranda. It's the Consortium for Advanced Training and Research and Training in Africa. You can share the link in the chat. Countdown 2030. Again, Miranda, help me find the link. It is a program that is led by our West African office. It is looking at using DHIs to data that is focused on maternal and child health. The data is accumulated. It is a system strengthening project where we work with the districts, the local data producers, and encourage them to sit down, look at their data sets around maternal and child health, address local challenges around maternal and childhood in the different countries, and then use that evidence to help in decision making. It's a partnership within the Ministries of Health and other research institutions. To date, the Qatar has a footprint in about 25 countries, and we're happy to share more around that. We can also share the recent LACENT issue that was launched last week based on all these data and analytical exercises that happen in these 35 countries. So it's really using data that is locally available to address maternal and child health in 30 African countries.
Thank you very much, Agnes. Does anybody else have any questions? Would you like to raise your hand, please? Yes, Eunice, please go ahead.
Okay, so in terms of collecting maternal child health data, do you have a standardized form that people use so that it's easy to make sense of the data? Or does, can anybody just use any data collection method and present it to other people? Or, like I said, is it standardized?
Thank you, Eunice. That's a very good question. What I can say is that one, the Countdown 2030 was leveraging DHIs to data. So this is readily available monthly, and I think to some countries, individual level maternal and child health data, where the indicators are already standardized and they're using these at the local level to generate evidence. However, there are efforts that have been led in this community and also the Odyssey, and I think that tool was the presentation by Odyssey is in the breakout room 1. There are different methods now of standardizing data, and these speak to different common data models that have been set out there to standardize health data sets. And we are happy to share most of those. But if you look at the Odyssey Africa chapter meeting, which I encourage you to attend, it's the other Monday. We spend 1 hour talking about methods for standardizing data, tools for standardizing data and harmonizing data. We can share the link to this through Francis and the larger community, and encourage you to join that discussion and see how lots of advances around data standardization and harmonization and vocabularies that speak to health data is going on globally.
Thank you so much.
You're welcome.
The next question is coming from Nafisat. I'm not sure if I pronounced that correctly. Please go ahead and ask your question.
Thank you, Cynthia. Cynthia is in here, so you can post that sheet and maybe give it to Francis. And I see the call. Is this one? But Salako? I can't see the question.
Hello, can you hear me?
Hello? Who is supposed to be asking the question? Is it
I was
Salako?
asking, but I can't. I want to confirm if you can hear me.
Yeah, I can hear you.
Okay, Salako, you can go first and then we'll have Nafisat after.
Okay.
Just to notice to Agnes that I've sent a lot of time email to her institution without getting feedback. I hope the next time with her email will work.
Thank you, Salako. I don't know which email you're using, but in case you have any questions, I've posted my email in the chat. I imagine you're using the info@aphrc.org.
Yeah.
And depending on who opens that, and we are about 300 staff with over 100 projects. I'm not too sure where it lands, but I will put my email in the chat in case you have any specific question.
Okay, thank you very much.
Georgina, you can go ahead.
So thank you, Agnes, and thank you, Esther, for your presentations. AFRE Health has talked about collaboration, and then I've just been wondering that we've worked through our proof project with APHRC, where you trained some people in data science. How can the two organizations collaborate? We have a lot of members who are early career and mid-career researchers, and I think that collaborating will also be very helpful to them. And data science is one of our priority areas that our council has also come out with. So Agnes, I want to know how AFRE Health and then APHRC can collaborate, especially as we've come to this platform, which is the essence of the networking.
Thank you, Georgina. And again, it's good to meet again in many fora and again in this session. Yes, like you rightly say, through the Proof project, we did have a capacity training component where we trained data scientists that were supporting the AFRE Health and Infectious Diseases, the IDI Proof project. These were data managers from academic institutions and also the National Public Health Institutes from the 12 collaborating partners. It was a 12 weeks course on introduction to data science. data harmonization. And we have developed a lot of content. And I am pretty sure also the DSI community has content that we can continue to leverage for such trainings like introduction to data governance, data anonymization, introduction to AI. We have a lot of content, but one of the most, maybe the lowest hanging fruit that we can look at is looking at our research and related capacity strengthening team. I didn't mention them here, but they're the ones that host the CATA program. This is a team that is doing a lot of research and, a lot of support in capacity strengthening. We have a virtual academy where we've placed several courses, some that speak to data science, some are speaking to mathematical modeling and data governance and data harmonization. What we can do is to share some of these with the AFRE Health community. And if there are any that are interested in this virtual academy, we are happy to see how that can move forward. The second is through partnerships. One of the things we have to do first things is to have an MOU. Like you said, some of these partnerships are formalized. I'll be happy to continue on here with a formal MOU between AFRE Health and APHRC so that we can then move seamlessly in the next steps. And I also see an opportunity to have, different research projects embedded and led by researchers that are in the AFRE Health community. Many times we have a research project in a country, just giving an example, like Cameroon, and we are looking for a researcher who could be our point person. So I see that the collaboration between AFRE Health and APHRC will be mutual and mutually beneficial, and I'll be happy to meet with you, Georgina and Esther, and to see how we can identify areas of collaboration around capacity building, project implementation, and other ways of collaboration. Thank you.
Thank you very much, Agnes. And I'm happy that our research committee chair is with us here. So she's picked up these things. So we'll follow it up after this meeting. Over, moderator.
All right. Next question is from Nafisat.
Hi, please confirm that you can hear me.
Yes, we can hear you.
All right, thank you. Thank you so much for the session. I joined in a bit late. I have a question with regards to the partnerships. So is the center only focused on partnerships that, have a health focus? If there are opportunities within the climate space, is this something that the center would be interested in partnering with other organizations such as eHealth Africa to, send in RFPs or to implement, as the case might be?
Yes, I only had 10 minutes to talk. I would have talked a lot about the ongoing research at the center. We do have a climate and health working group, and that is looking at several projects, many of which are in collaboration with different institutions, like some based in South Africa and Burkina, Mozambique. We have at least, and I don't know, maybe around 10 projects that are working on climate. Some speaking to climate and food systems, climate and policies, and also a lot of work that is going on in the West African region, with the West African office that's looking at extreme weather events and how these are affecting different health outcomes. So we are happy to give you more information off this call. But back to your question around collaboration, yes, we are happy to have collaborations that speak to climate. As you rightly said, it's an emerging global and also continental crisis. There are different scopes of work, different projects that are going on in this area. And listening to where you are speaking, coming from the e-research, I think different issues we need to deal with as a continent. How do you get access to climate data? How do you validate it? How do you relate it with health data or different kinds of data sets? So we are happy to share our experiences. We do have a lot of projects that are going on in climate, and we are keen to collaborate. So the mental health data prize that I mentioned was specific to mental health, but there are other projects and researchers that work with climate, and I'll be happy to follow up with you if you share your email address.
Thank you. I'll do that. Thank you.
The next question is coming from Duyilemi. Hello, Duyilemi?
Dr. Johnny Jebu, if you're speaking, you're muted. We can't hear you. I think there's
Sorry, I'm muted. Sorry, you're muted. I think you'll need to unmute yourself. Unfortunately, we can't hear you. I don't know if you're able to type your question in the chat. Is there anybody else who would like to ask any questions? We have about 3.5 minutes left. Okay, there's a question here that says, are there opportunities to partner with individuals such as myself? I'm a senior researcher compliance advisor specializing in preparations for IRB submissions and responsible data sharing.
I'll pass that to the AFRE Health team.
Georgina and Esther, are you still on the call?
Yes, I'm here. I had a short break, so I just want to, there was a little break, so I didn't get the question well.
The question is, are there opportunities to partner with individuals such as myself? I am a senior research compliance advisor specializing in preparations for IRB submissions and responsible data sharing.
Yes, there is a great opportunity for you, so we can link up, because one of the challenges that we even had in the proof work, that is the program for vaccine effectiveness implementation science work, was IRB, which delayed our work a lot in almost all the 12 African countries that we worked in. And so your expertise will be great for us and for our people. So we are happy to work with you. So we invite you to be part of AFRE, join the AFRE Health family, and then you can really be of use to all of us. You can also learn from others, because it's not about only you benefiting us, but all the members also benefiting you. So best, I think that's the name, that opportunity is there for you.
Thank you so much, Agnes. I will write to you via your email and we can connect. That's very good news. Thank you.
Georgina from AFRE Health. So
Georgina.
Oh, Georgina. I'm so sorry. Yes.
Myself, and then after we have our email in the chat box.
Okay. Thank you, Georgina.
You can also post yours for us to pick.
Okay. I will put mine.
All right. Do you let me write here? Are there opportunities for academics to partner with APHRC for research on mental health, and are we allowed to use the data for academic projects? Please note we have about a minute and a half left. I don't know if maybe you want to exchange emails so you can.
Yes, I think I can exchange emails, send it to me when we are in the larger group, because yes, the 10 funded projects will have data sets at the end of their projects in about a year's time, and this data will be made available for additional collaboration, but happy to provide more information or link you up to the mental health data prize team.
Thank you very much for that, Agnes. And then there's also a message here from Cynthia with information about the OHDSI Africa Symposium. Those who are interested, please kindly take note of that. Yeah. I don't know if anybody else has any quick question or any other extra information you'd like us to be aware of from AFRE Health and APHRC.
None from my end, just to please encourage us to sign up for the Odyssey Africa chapter meeting and plan to attend the symposium. Like Cynthia has said, we always meet every Monday. And also, if there's anything on APHRC, please drop me an email and we can link you to the right teams. Thank you, and thank you for listening.
Thank you, everyone, for joining. We'll see you in the next round.
Thanks everyone for joining.
Thank you. Let's keep on connecting.
Thank you.